Hey, Julian, y'all can hear me. Um, I just shared a link, a Google Drive link in the chat with everyone. That is our final document of our strategic plan, just so everybody can kind of look at that for this meeting with all the committees and everything we plan to do for 2024. So I just wanted to share that over there.
Thank you, Emily. Y'all are super quiet today. So I want to remind everybody right now, if you have an event or activity or anything coming up that you want to share, please share it. We'll give everybody just a couple more minutes to see if y'all have anything you want to share. And if not, we'll move into our speaker part.
Hey, Jillian, this is Tyler Niggs. I don't have any events or anything, but I would like to introduce myself. My name is Tyler. I work with Maxim Healthcare Services. I'm the new Senior Business Development Manager over the Greenville and Johnson City office. We provide private duty nursing, which is a special little niche in the healthcare community. So I did put my email in the chat box. I will also put my cell phone number. That way, if anybody has any questions about what private duty nursing is, what a typical referral for us looks like, and how we can help in Carter County, please let me know. I know way too much about insurance and all that navigation and other resources in the area. So thank you all for having me.
We're glad to have you, Tyler.
Vicky got
Y'all make sure you check out the chat too. We've got people adding some events and activities there. Anybody else have anything before we move on?
This is John Knack with Creekside. How's everybody? Hope everybody's doing well. So January 19th at noon, we're having a grand ribbon cutting for our new 24 beds at Creekside. So we'll have a total of 96 beds. We're also doing Zoom assessments now. So if somebody's in Carter County with a doctor, with a therapist, with a healthcare professional, they can give us a call and we can do a crisis assessment from Creekside, so they don't have to drive to Kingsport. And then at that point, we would let them know what criteria they meet and offer them services if need be. But we're always open 24/7. But if somebody can't make it or would rather do a Zoom assessment from their provider's location, we can do that. Just to give me a call, I put my information in the chat. Thanks a lot.
Hey, everybody, this is Caroline from the health department. And I would like to just talk about a couple of newer things. We've got a new interpretation service. So if you have limited English speaking populations, or if you have sign language needs that would be appropriate for the health department, we do have a new interpretation service that is very easy to use, and it's really high quality interpreters, and it's completely free of charge for anyone who needs it. The second thing is we're really trying to focus on bringing our higher level providers and our nursing staff out into community places and programs and organizations and entities. So to do a variety of services, whether it be immunizations of all kinds, screenings, some different STD screenings if needed, fluoride varnish applications, because we know dental is so hard to get, dental service and dental access is so hard to get. So if you've got a business, residential treatment center, where you've got a population, youth residential centers, school systems, we're working very closely with the school systems. But if you've got any of those collective, if you have organizations that have groups in, periodically that might benefit from these services, we would love to talk to you about that. So please give us a call at 543-2521 and ask for our nurse supervisor, Carissa Shepherd, and I'll put all that in the chat. Thank you.
Hey, it's Tia with Bridge to Shore. I'm going to put a flyer in the chat. So UT Extension is doing a donation drive for us. We are needing things like new hygiene products and cleaning projects or products. They're accepting things for us from November the 15th to December the 20th. And so I will put the flyer in the chat if you all know anybody that is looking to donate around the holidays. Thank you.
All right. Anything else y'all want to share before we move on? Okay, if I can draw everybody's attention, I'm going to share it one more time. Emily has shared it once already. I'm going to share it again. If y'all will take just a second to pull up the strategic plan. So our CCC leadership has worked to create this strategic plan for the next year, looking at what the CCC as a whole it wants to focus on, as well as specific strategies for each committee that we have. So if y'all will take just a second and pull that up and let us know if you have any feedback before we vote to.
Hey, if anyone had trouble viewing the link, I think I made it where everyone with the link can view it.
Emily, I can view it.
Okay. Anybody have questions, comments, thoughts on that before we vote for it? If you're ready to vote to approve it, I'm going to remind everybody the way that we vote to approve things. We do a fist to 5 method. So you can say 0, I do not agree with this at all. 5, I fully agree with this, all on board. Or you can say anything in between. You can give it a 2 or 3 or 4. So if everybody will vote in the chat to approve this year's strategic plan. If you don't want to vote publicly, you're also welcome to send me a private message. All right, y'all. So you can continue voting if you haven't already, but we are going to go ahead and move into our speaker portion of our meeting. And so Emily Matthews is going to share with us today. So I will turn it over to Emily.
Yeah, but I'm just saying.
Can you let me share the screen and pull up my PowerPoint?
You should be good to share now.
Yes. Okay, can everyone see this?
Yes, we can see it.
Okay. And then Chelsea Isaacs is also here in the meeting with us today. She's going to be helping present with this presentation as well. Chelsea, can you see the screen and everything good?
Yes, I can.
Okay. I'll go ahead and get started. So my name is Emily Matthews. I am Coordinated School Health Director for Elizabethton City Schools. And we just wanted to give this presentation to the Carter County Collaborative because we have a new really cool resource, the Family Resource Center at Elizabethton City Schools, and we wanted to let the community be aware of everything that we're doing, but we're just getting started. So what is a Family Resource Center? So school-based family resource centers were developed in 1993 by Tennessee Department of Education to address potential risk factors in the home that impact the student's ability to learn. So it's outlined in Tennessee Code Annotated 49-115. So potential risk factors can include anything like homelessness, poverty, hunger, substance abuse issues, mental health issues, and other barriers to optimal health. So Family Resource Centers work with students and their families to create solutions and bridge the gap between families and community resources. The mission statement for Tennessee Family Resource Centers is Tennessee Family Resource Centers Unlock Potential. So there's like 50% or like half of the districts in Tennessee have a Family Resource Center. So Elizabethton City Schools is joining. Carter County Schools, I believe, does have a Family Resource Center already. So we're happy to be joining them. So Tennessee Family Resource Centers have a three-pronged strategic approach that includes families, readiness, and communities. So this is just showing you what the state wants our Family Resource Centers to focus on. But really, they're very broad because they want us to be very specific with how we tailor our Family Resource Center to our community and our students. So we've been approved to have a Family Resource Center already for this school year. We just aren't, full-fledged yet, and that's because of our location. So we do have our director. It's going to be Chelsea, who's going to talk in a minute. She has been our district-wide social worker for the past few years. And then our location is going to be a newly purchased building from Elizabethton City Schools, and it's the previous Union Prescription Pharmacy on Bamberg Road. So it's across from the high school. They're going to call it the Community Development and Engagement Center. It's going to have a couple things there, mainly a big meeting space for trainings and professional development. It's going to actually have our alternative school there, and then some offices and storage for our Family Resource Center. So all of our social services that like Chelsea's already been working on, they're not going to end. They're going to hopefully expand with our Family Resource Center, and they're going to continue happening. And then all funding for Family Resource Centers this year, it's all brand new as well. If you know anything about school budgets and state government, we've got a new funding formula, TISA. That's the Tennessee Investment Student Achievement. And this is the first year, but they used to operate as a grant. Now they're included in that base component of TISA funding for all schools. So that's it's a good and bad thing. It's good that we're included in the base component, and then it really puts all budgets on local leadership. So all those decisions are based on our local administrators here. So there is a community need for Family Resource Centers, and I know this group is well aware of that. A lot of this data is just pulled from our community health assessment that we just did. So the Family Resource Centers are supposed to serve as a hub for social services and mental health supports. And like I've said, we tailor the programs and services to match the specific needs of our community. And obviously Carter County shows a need for increased mental health supports and social services. I've got listed here in Carter County, 15.8% of youth age 12 to 17 reporting having a mental illness in the past year, which is higher than the state average of 13.72%. The Carter County poverty level in 2021 was 17.1% compared to the Tennessee's poverty level in the same year, which was 13.7%. Carter County's unemployment rate is higher than the state and national average at 3.6%. And then also I wanted to include that last one because, and for all of Tennessee Family Resource Centers, connecting families and students to food services is actually their biggest service across the state that we do. And that's definitely a need in Carter County because there's a 54.2% utilization rate of the SNAP program in Carter County. So that's showing that almost 50% of families that are qualified for SNAP are not using the program. So there's definitely a need to connect a lot of our families to available resources. We were also able to do a needs assessment with our staff, and then there was one here in the Carter County Collaborative that some of you participated on, so thank you for that. And it kind of just confirmed some things we thought. We know that for our school system, a lot of our social services are underutilized at the moment, and there are a lot of reasons for that. Just there's some communication issues, and then a lot of this is new, and teachers have kind of been meeting the needs on their own time with their own money. For the past several years, so they don't realize that we are here and we're able to help them now. So when we did that staff needs assessment, it showed us that 70% of our staff surveyed didn't know how to access the student need referral form. That's going to be the way that students are referred to Family Resource Center and to Chelsea, but this is also the way we've been referring students to our social services since Chelsea's been here. So over 3 years, there's still a big chunk of staff that aren't sure how to access that referral form. So that's a big thing that we want to focus on, just bringing awareness to our services. And then besides meeting like basic needs like food, shelter, clothing, staff believe that addressing chronic absenteeism should be the highest priority for our Family Resource Center. And chronic absenteeism is like the step before truancy. So that's like if you're out of school, I think this 10% of the time you become chronically absent. And then we interviewed some people here, and we got 50% of community partners were aware of what Family Resource Center, which is good. So, but there's still definitely room for improvement of awareness. That's why we're doing this today. And then 100% said that they would like to be a part of our advisory council that we're going to have to really guide and make sure we're doing what our community and our stakeholders need.
Okay, so as Emily said, my name is Chelsea Isaacs, and this is my third school year with Elizabethton City Schools as the social worker, and I'm kind of transitioning into this new role because I was funded through COVID relief, and this is kind of how they're trying to hold on to my position here. So at the end of last year, we created our action plan. It is comprised of 6 goals, and so here is the ones that we came up with. Our first goal, we're working to increase our amount of student referrals. As Emily said, we have had a challenge with getting teachers to use that referral form and reach out. Goal 2, we're collaborating with our McKinney-Vento program. So that is our program that we classify our students homeless underneath. Goal 3, we're working on our chronic absenteeism. As you probably know, within a lot of school systems, we have a huge issue with truancy. So that's a big battle for us. Goal 4, support the literacy bus program. Goal 5, strengthen family engagement. And then goal 6 is improving community partnerships. All right, so a little bit about our current programming. So luckily, we do have a partnership right now with United Way, and through that, they give us a Fit for Success grant, and I have a little bit of money that allows me to buy like emergency items for families. So if they need clothing, shoes, school supplies, I think that we can pay for glasses out of it, several different things. So that's really nice. We're very thankful that they give us that support. We also work well with Second Harvest with our weekend food bag program. It serves 112 students that we have right now. Luckily, we have partnered with Carter County Drug Prevention, and over at South Hills, they allow us to use them as a temporary location to store some of our things. So we're also very thankful for that. They're always letting me stuff some food boxes there, some backpacks, whatever we need. We're very grateful for that. And then just all other case management needs. So if we have a family, they're just struggling, maybe they need someone to go with them to a school meeting or help them with a 405 plan or whatever it might be, just linking them to things in the community, kind of just being that extra handheld support for them. So what's next? What do we need from everybody else? Well, we really need to work on building our awareness, making sure that people know who we are, what we're trying to work towards, get those stakeholders interested in, helping us with that mission. So we're also going to be establishing our advisory council. So we want majority of that to be composed of our families. We want our parents to attend these meetings, give us the input on how we can best serve them. But we also, want our stakeholders, people like you guys that can best help guide our practice and make sure we're on the right path with our programming. So this council will meet twice a year. Right now, we have a tentative date to have our first one on February 8th, probably at 6 p.m. either here at Carter, our central office, or down at the high school in the commons area. So we would love if you guys could come help us figure out, what our focuses need to be and get us that valuable information to help guide us. And then also we need to utilize ourselves and familiarize ourselves with our student need and family assistant referral form. So I have some screenshots that kind of show you how to guide yourself to it. So if you go to our webpage, you can click departments and you'll see where it says social worker district. You can click on that and then it'll bring you to a little page that tells you a little bit about me, and it has our referral form hyperlink. And I have a Google form where it was created for teachers to be able to plug in quick information and, as well as parents as well. But, if you guys are working with families and you think that they need to be connected to us, please point them our way. We want to be involved in helping as many of our families as we best can and just be reaching all of them. Okay, here's my contact information. That's my work cell and my work email. And then we have also created a Facebook page, so please follow that we're trying to share everything that we're doing, all of our upcoming events, meetings, and things like that. And I think that's all I have for you guys. I'm always available by call or text or email. You don't have to fill out a referral form if you have a family you'd like us to work with. Sometimes I am more of a call kind of person. But does anybody have any questions?
I do want to just briefly add, whenever our new location opens, we're really excited about it, but of course it's just taking forever. Hopefully by August, but we'll invite everyone to come and of course look at it. Hopefully we'll do a ribbon cutting and we'll be able to really get going with our new location. But please follow our Facebook so that you can get all of the updates and see information about our Family Resource Center and our advisory council and the events that we're doing.
All right, thank y'all so much for sharing. I am putting a note in the chat with just a couple ways that y'all can support Carter County Drug Prevention this month. We are working Speedway and Lights every Wednesday, so y'all come visit us at Speedway and Lights. And then we're also selling s'mores kits at the Skate on the Dough ice rink every Saturday night, so y'all come ice skate and see us there too.
If we could, that'd be
So I'm going to ask each of our committee leaders to share a little bit about what their committees will be working on today. If we can just have y'all give an update, and then folks, y'all can decide which committee you want to join or if you want to leave from here. So committee leaders, if y'all will share what you've got going on.
So in Committee A, we're just going to be talking about different events that were going on in the area and things that we can do to jump in to help. And we've also added the new prevention piece on with Committee A. So we're going to kind of discuss that just a little bit today.
Sorry, I've got 10,000 tabs open. This is Gabby Smith. So with committee, I'm guessing B, but it's the Carter County wide committee, the one that kind of is a catch-all for everything. We're going to be talking a little bit more about the strategic plan and what we came up with in our last meeting. The two objectives we came up with which one is focusing more on mental health, and we kind of discussed targeting mental health with youth and schools and things like that, but also reaching out to people in the community and making sure they're connected with mental health services just that are already available in Carter County. And then our other objective is talking about food insecurity with Carter County families and kind of where we want to go from there. So if any of those things fall into your wheelhouse, please join us, and just know that the idea behind this subcommittee is really to be able to kind of target things outside of substance misuse and recovery, and also all the great work that the committee see with data, handing out data on what's going on in Carter County. So this is kind of a catch-all. So these are our two focuses right at the moment, but it doesn't mean that that's where we're going to stay for forever. So if you just want to be involved in improving, things that Carter Countyans are concerned about, then hop on over.
And then the assessment and data committee, we're just going to kind of review our plan, get some updates from a steering committee meeting from Tyler, and then just start planning to meet our objectives with really getting some deliverables with our CHA data package for all of our members to utilize, and working on getting our branding and purchasing our logo.
Hey, Julian. I wanted to give a brief update about our schedule for next year, since everybody's here. I did want to let everybody know that we got our schedule worked out for 2024 for our CCC meetings. We're still doing the first Thursday of every month outside of July this year. It would fall on July 4th, so we're going to take the summer off and not meet in July. Another fun thing that we're going to start doing in 2024 is we're going to have 4 in-person meetings quarterly. These are going to be outside of our monthly virtual meetings, and these meetings will fall on the second Thursday of March, June, September, and December. So if you want to write these down, that's going to be March 14th, June 13th, September 12th, and December 12th. And at these meetings, they're going to be a little bit different than our normal meetings. This isn't going to be kind of like a networking, but more of a kind of action meeting where our subcommittees will kind of break out work within their subcommittees for a little bit, and then maybe come together during those meetings and see how we can help each other accomplish goals through our strategic plan. But everybody is welcome to attend. We will have a lunch, and those meetings are going to be at the Carter County Health Department. But if you have any questions, let me know. I'll be sending out our normal meeting reminders every month. And then for those months, you will also see another reminder for those meetings for that following Thursday. Is there any questions about those or meeting schedule for 2024?
Tyler, it's Caroline. I put those dates and times and location in the chat.
Yes, thank you so much. All right, thank you all.
All right, thank you, Tyler. Thank you to our committee leaders. I'm going to go ahead and open up the breakout rooms now. You are, again, welcome to join any breakout room that you want to join. And when your breakout committee is finished meeting, y'all are free to go, and we'll see you next year. Thanks for being here.
Thanks, Jillian.